Joining us is Dr. Kwanzaa Pinckney. She's a nationally recognized board certified emergency physician, self taught master mixologist and DJ, and public speaker. And she also is a BMS TV family member. Welcome back to the show.
Thank you. Hey, everybody. Hope everybody's good out there. What's up? What's up? What's up?
Well, tell us how you doing, sister? Because we got a lot of people asking about you. They want to know
Okay.
about our family doctor.
Man, I'm doing all right. You know what? It's been a struggle. I was telling you before we kind of got on air. My father-in-law is actually getting discharged from the hospital today, and the interesting thing, he contracted COVID back in March, and so it's been a struggle. I mean, so unexpected, obviously, but who expected all this, right? And so the interesting thing is he doesn't have insurance, and it's been interesting being on the flip side of this whole COVID pandemic. From the patient perspective, it's been really, really hard watching this process. They at one point wanted to make him like a do not resuscitate, and we're like, he's 58, we're gonna try, and he made it through that, and then now time's up. They're pushing him out the hospital. He needs oxygen. He needs all kind of stuff. But there's other factors in there about, just how you planned and set up your life, and how that affects your family and friends. And so we're having to take on a lot of responsibility to manage his care from home. And so it's just something to think about, I think, for all of us as humans and family members and loved ones about what's the next steps in terms of, helping people once they get home. I mean, so they're sending him out. He got a bed sore. He ain't got no bed. I mean, they're just like, hey, he doesn't have insurance. It's time to go. So it's, a lot of things to consider about long-term planning, just period. Like, have you done that? Are you ready in the case of an emergency? And, what kind of impact is that going to have on your kids and your family? It's been an interesting journey.
Yeah, well, Houston has definitely been on an interesting journey because I've been tracking what's been going on in Texas, and your state is reopening now. I mean, I looked at the whole aspect of how they're allowing people to collect now. Your debt, they're allowing people to be evicted right now. A lot of that stuff is, the Supreme Court ruled in favor, saying that all that stuff can start again, and I'm sad to see that, because I know people haven't been able to restart their lives, especially economically.
Well, right. And so, unfortunately, it depends on how you fall on the spectrum in terms of your political beliefs. And basically, if you live in Texas, we're under Republican rule at this time. And so we didn't take Medicare and Medicaid dollars for uninsured. So if you find yourself in that position and you're not in a state like New York where your state has come in and said, we're going to offer, benefits or relief for uninsured patients, affected by COVID or, other outstanding, emergent medical conditions that require hospitalization, you're basically screwed. I mean, so in this case, like, we can take this as a great example, not quite 65, so you don't cover for Medicare. Medicaid, I think we've been on hold for two days straight trying to get somebody, an actual live person.
Wow.
And we don't have, and based on, when you go to the government website, basically it's too sorry for you. And then even just buying insurance, because President Trump has not released it's like a waiver sort of, so that you can buy a personal insurance plan, because we were just going to buy him some insurance, right? You can't even get in if you don't meet, basically you have to meet certain criteria to get eligibility for insurance during a non-open enrollment season. And so what that means is that unless you had a death, and he's self-employed, so unless you lost your job and had benefits and lost benefits, you just don't qualify for anything. So how do you get care?
Yeah, it's interesting because a lot of people have been arguing about that particular issue as why he hasn't reopened Obamacare to give people access to the healthcare that is needed, especially during this emergency. But he keeps talking about other things and trying to keep it out of the politics of it, because I don't want you to get involved in that. That's what I take on. But what I want you to do is I want you to talk a little bit about your article, because you did an excellent article, and I think this is important. How to advocate for yourself during an emergency room visit, and talk to the people about these things, because a lot of times I'm hearing from people reaching out to me saying that, you know, I can't really get in touch with anybody. I don't know what I should be doing. And I don't, it's hard for me because I don't have the expertise to give the advice that they're looking for.
Right. So one of the biggest things is, I mean, so this is tough, right? So we're all in a situation where, you know, even for us as medical providers, it is very challenging to get information. We don't have visitors in the hospital. We still don't. So you're relying on a sheet of paper of somebody passing you a note saying, hey, this family wants to talk to you. And so persistence and patience is going to be key. And also having a solid foundation. So what I talked about in the article on Zora is one is having a personal plan, like having your medical problems written down. If you have a power of attorney, who that person is, what their best contact information is. Also, kind of thinking long term and just saying what medications are you on, having that already written down so that there's no guesswork, right? And then as a family member, one of the most important things is to be persistent, like persist the squeaky wheel, you know, I forgot the saying there.
Gets the oil.
But gets the oil. So you have to be persistent, and that's what we've had to do. You know, even in my own personal situation is we expect that a member of the team is going to call back, and if they can't answer that question, we keep kicking it up. So the way organizations are generally set up, you have your primary nurse who's going to be in charge of just, you know, dispensing the meds, carrying out the orders. So you can always ask to talk to them first. And if they are not able to accommodate you, you kick that up one notch. There's a charge nurse who supervises the nurses on the floor. You ask to talk to that person. If you can't get an answer there, you kick that up to what's called a house supervisor. They manage all of the charge nurses and everything going on in the hospital. If you can't get an answer there, you ask for a patient care advocate to help on your behalf to coordinate communication. Because once you start going up that loop of administration, they don't want complaints, if that makes sense. And so you have to be persistent and you have to be willing to take it to wherever it needs to go to get your answers in a timely fashion. And once they realize and see that you're not going anywhere, they will be more apt to be responsive, and you'll find that the care will be better too because they know you're watching. So we've had to be really tightly involved in the care to the point of, you know, 2 times a day conference calls, like, no, we're going to speak to a provider. We're going to speak to a physician. We're going to know what's going on. We want to know what his daily labs are. We want to know, even if you don't understand everything, but they know that you're checking. And it's not that, and I'm going to say it's not that people, you know, mean to do it on purpose, but it's just human nature. If you don't have to do something, you won't. And so if you force that and they know, like, hey, as a family, you're looking out for this patient, they're more apt to be responsive overall. And certainly I stepped in, I talked to the physicians because I'm like, hey, you're not going to do anything you want to. You're not going to make him a DNR when he's got a good chance of survival. He needs a little bit of time. And sometimes you just have to push and say no. And, you know, I'll say this, even as a provider, it's very challenging because it's scary. It's different when it's your loved one. And so to have someone to tell you, you know, he's probably, your loved one is not going to make it, you know, you're having to trust someone you've never seen, never met. And sometimes just asking the questions of saying like, hey, I'm not ready to make that decision. And so you don't have authority to just do whatever it is that you want. It's really, really important to stay in close communication and kick it up the chain. So it's, again, the nurse and then the charge nurse and then the house supervisor, and then it just continues up from there. And then you ask to speak to the doctor until you get them. And it can be a frustrating process, but at the end of the day, you know, that is their responsibility, and we all know that. And so they have a duty to provide you with that information. And to ask a lot of questions. And then when you're talking about being discharged, you know, ensuring that you have an understanding of what needs are going to be required. So if I take it back to the case of my father-in-law, he basically, you know, is going to need dialysis. He's going to need wound care. He's going to need physical therapy, occupational therapy. And so you best believe at 3:30, I'm going to be on FaceTime with the case manager asking, well, what have you provided us a decent list of facilities? Have you provided this? So if he's going to be discharged, how are we going to manage that? Or else he's going to be coming right back to you. And, you know, unfortunately, you hate to have to be like that, but that is how you have to advocate.